Today, what we're going to talk about is using our Astral 150 as a backup vent to the servo in a situation where we would run out of servos, they're all in use, and we have another patient that needs to go on a mechanical ventilator, and this is going to be our option to go to is the Astral 150. So first, there is a PowerPoint-like presentation that I've emailed out to everybody that kind of step-by-step shows how to configure and set up the circuit for this system. So we're not really going to cover that in this video. What we're going to do is just cover the main kind of nuances that are different with this versus the servo. So first of all, our kind of focus is to attempt to recreate the servo with this vent in a, if at all possible. And we know anytime you go from one vent to the next, it's not going to be the same. There's always going to be things that you can't change that are a little different, whether the bias flow or the actual resistance of the expiratory cassette, the injector modules. There's lots of things that change different from vent to vent, but we're going to do our best to do it. So first we're going to use the dual limb circuit just like we use on the servo. You all know most Astrals are set up with single limb circuits for home use, but we're going to use the dual limb circuit to try to recreate everything as in the way of the servo. So we're going to use the same size circuits we do on the servo. 15 kilos and less is infant, greater than 15 is an adult. We're going to use our circuits with our heated wires and our heaters, just like you see here in front of you. And our process of NEB delivery, MDI delivery is going to be the same placement and delivery practice with this, just as it is with the servo. So let's talk about little things that are just specific, like turning the vent on and getting into the functions and the modes itself on this video. So first we're going to turn this on, and it's the button on the top, and you hit it, and when it comes on you see unlock screen, yes. You could start ventilation, and you're going to see it says it's not doing anything. So here's kind of the thing that gets me is you have to hold this button, the lock button, down there for at least 3 seconds, and you'll come to this screen. You want to hit unlimited. That gives you access to changing all the settings. And every time you turn the vent off and on, you're going to have to do that again. You're going to have to go to unlimited because it resets when you turn it off. Okay, so now you're in the setting. Currently, you're in the setting section of the vent. Here is the mode option. So I'm going to hit this. This gives me the available modes. Now, the only two modes that we're going to use, or we're going to suggest to use, is this PSIMV, which is equivalent to SIMV pressure control, pressure support, or pressure support, which is equivalent to CPAP pressure support. Now, in these two modes, we're going to attempt to recreate what the servo does and not do anything else, right? So in pressure control, SIMV pressure control, pressure support, all your orders are going to be ordered the same as the servo, and you're going to set everything the same as you do as the servo based on our policy. So you have your pressure control that you're going to order. That's going to be just like the servo. It's not PEEP compensated, so it's below your PEEP. You have your PEEP ordered. You have your rate ordered. Pressure support ordered. Your rise time is again usually not ordered, and we're going to set that to attempt to get a decelerating waveform, which we're going to do on this vent as well. You have your I time. If it's not ordered, we're going to set that just like we do on the servo to get at least a zero flow waveform within the patient's age group on our waveform on this vent as well. And if you can't get to zero flow, you're going to need an order for that, or if the physician chooses to order it, you'll have an order for that. Our percent cycle, we're going to set that just like we do on the servo. However, the servo will go down to 1%. This vent will only go to 5%. So the shortest you can have that is 5%, and that's what we're gonna want it at 5% on this, just as we do the 1% on the servo, and you're gonna adjust that just like you do the same practices you do on the servo. The trigger, very high is most sensitive, very low is least sensitive. So if they're not cycling the vent or they're not triggering the vent well with their effort, you're going to put it on very high, right? Very high. And if they're auto cycling or it's picking up a hyperdynamic pulse, or the auto cycling is happening, then you would adjust this down. Now, what I'm going to say about this is This vent is definitely not as sensitive to the trigger as the servo is. So what you probably want to start on very high, and then if the patient still is not triggering any of the pressure support breaths, then you want to look at getting rid of any dead space in the circuit that you're able to get rid of with the physician, i.e. that anything dead space is anything in front of the Y. So that would be your end-tidal monitor, your inline suction catheter, or your Omniflex. Those are basically all we usually have possibly on patients that we could get rid of to help the triggering mechanism. Manual breaths. So to start that, you'll hit accept. Manual breaths here you want on. 100% says you want to give them 100% of your set volume, set pressure. So just have it set at 100% and that'll be there. And that'll be your settings in SIMV pressure control, pressure support. So over here you have your waveforms. So you're going to monitor your waveforms just like you do on the servo. You're going to look at everything just like this, like you would in the servo. Let me put some settings in here. Okay. All right. Accept, and I'm monitoring. I'm looking at my waveform. You can see here that my eye time is not long enough because I'm not going to zero flow. So I would just, in my normal practice, go up on my eye time to where that happens. Again with the waveform, and again looking at my waveform. So same practices that we do currently with the servo, we will do here. Okay. Okay. Now let's look at alarms. Okay. Alarms here. We're going to do the same alarms in our policy minimally. So minimally meaning this vent will do the alarms that the servo does and then some. So minimally we're going to set our alarms minimally here as we do on the servo, and then any extra alarms that this has you can set as well, but they're not going to be covered under policy. So you know how to set your alarms. You're going to do that here as well. You can see it has multiple different alarm availables. Okay, let's say to stop ventilation, you're going to have to hold this for 3 seconds, release the key, and then confirm to put the vent on standby. Again, this top button has to be unlocked for any of this to happen. And any time this is locked, it's not going to let you do anything on as far as changing settings on the screen. Okay, one other thing we're going to look at here is CPAP pressure support. When you go to CPAP pressure support, you see there's some other things in here like rate. So we're going to, when we order CPAP pressure support on a patient, we're going to mimic the servo, and that's what we're going to try to do here as well. So we do not want a backup minimum rate, so we'll turn our respiratory rate off. Safety tidal volume as well here, which really resembles volume support. We're going to have that off as well. So off the rate, off to the safety volume. And then your rise is applicable just before. Your minimum eye time and your maximum eye time. You're going to set your maximum eye time to the highest eye time for that patient, you know, based on our eye time policy, not because it shouldn't matter in this scenario, but to set it. And then your minimum, you'll probably set that minimum to the minimum eye time based on our eye time policy as well. And then your trigger and your percent cycles at 5%. As close to 1% as we can get it equally to the servo. Okay. Now, those are the only two modes we're going to use. This PSIMV, which is equivalent to pressure control, SIMV pressure control pressure support, or the PS, which is CPAP pressure support. We're not going to use the this PACV. We're not going to use any of the volume modes at the top. Those are the only two modes we're going to suggest that this vent will be able to replicate for the servo itself. If I have forgotten anything or you have any questions about this, please feel free to call me. You can text me at my home phone at 254-718-1490, or call me at work if I'm here, if I'm on the schedule for at 86753. I'll be happy to talk to you about anything. I'm sure I left some things out. All right, thanks.